everybody. Welcome back into Good Morning Arkansas. As a hospital patient, we all have specific rights. Do you know what they are and how they can benefit you and your family during your time as a patient? Dr. Tom Cummins, Chief Medical Officer at CHI St. Vincent, joins us this morning with details about patient rights. Good morning, Dr. Cummins.
Good morning.
Thanks so much for coming in today.
Absolutely.
Talk about the basic premise of patient rights. A lot of people out there probably don't even know that they have certain rights when they're a patient in a hospital.
So in the hospital, everybody has all the normal rights, the federal laws, the Civil Rights Act, other laws mandate that we treat everybody regardless of race, gender, economic status, ability to pay. You have the right to treatment in a facility every time you come.
Okay. All right. Now, how does something like that specifically translate to a hospital, though?
Well, the big deal in hospitals is to treat people with courtesy, dignity, respect. We need to take account your values, your beliefs in helping formulate a plan for how we're going to take care of you.
Can a patient then require a specific treatment at any point?
They can request.
Okay.
I wouldn't say demand or require.
Okay.
The goal is for the patient to engage with their team, their doctors, their nurses, and the rest, to develop a plan of care, to figure out what works best for them and their needs and desires. And so that's what we try to do.
Yeah, I see a list of things here: knowing health status, making informed decisions.
Absolutely.
And then, of course, develop a treatment plan. Now, I know there are often media reports about patients refusing certain treatments. What rights do patients have when it comes to refusing a form of treatment they don't either believe in or don't want their body to have to go through?
Patients absolutely have the right to say no to treatments. They can, for religious reasons, for example, Jehovah's Witnesses have very specific religious beliefs. They have the right to say no to certain things as providers that we would offer. Also, there's the advance directive or living will. That's a written statement of what you want done or don't want done that every patient should formulate with their families and their primary care physicians or primary care providers, so that when the time comes and you can't speak for yourself, everyone knows what it is that you want done.
Let's talk about patient privacy a little bit. I know this is a big point of emphasis in today's society with so much not private these days.
Exactly.
This is, I know, still very much valued in hospitals.
Right. Patients' information is extremely private. The Health Insurance Portability and Accountability Act, well, that's a mouthful.
Yeah, we all know HIPAA, right?
Or HIPAA. HIPAA better. Protects patients' information, including things like their diagnoses, both physical and mental health.
Okay.
The things that have been done for them in the hospital, and even more basically their name, their social security number, all that private information that we all worry about in this internet age of data floating out in the clouds and so forth. So hospitals and doctors take that information very seriously, and it's strictly regulated.
Okay, what about any information that must remain private that isn't necessarily health information, though? How does that work out?
Absolutely. Again, that goes to the name, the social security number, all those kind of things, the very things that people try to steal for identity theft. We also guard that information very, very closely.
And finally, anything you want to remind anyone out there about who might be in a hospital room right now about their rights?
Ask questions.
Okay.
Ask your provider, what's the best choice for me? What do you suggest? So that you can make the best decision for you. It's not up to the doctor or the nurse to make the decision for what your care should be. You have every right to ask questions and make a better decision.
I know one thing too that patients may not think to ask about, but would options be one of those things that they should always ask for off the top instead of whatever suggested? Hey, what are the other options?
Absolutely.
Okay.
In any time we're treating a patient, there are a number of options for what should be done, whether it's surgery or medicine, or sometimes it's nothing. Sometimes the option is to say, thanks, doc, I think I'm just going to do nothing right now. And that's absolutely a right that every patient has.
Ask questions. It's great advice today from Dr. Tom Cummins, Chief Medical Officer with CHI St. Vincent. There's the information for St. Vincent. Of course, you can always call ahead of time, 501-552-3000, and visit them off to St. Vincent Circle here in Little Rock. Dr. Cummins, thanks for coming in today.
Thank you.
Appreciate you stopping by and answering some very important questions.
Absolutely.
All right, coming up next, we're making juicy